Can you confirm that you can see my screen, please? Okay, perfect. So, first of all, let's finish this up. So we were speaking about the nephritic and nephrotic syndrome. So which one has the Coca-Cola colored urine? Nephritic or nephrotic? Answer 1 or 2. Coca-Cola colored urine or red urine. Nephritic, nephrotic. It's nephritic. Nephritic. Coca-Cola colored urine is nephritic. Okay? Okay, so if we speak about acute post-streptococcal glomerulonephritis versus IgA nephropathy, the main difference is the time. Which one occurs sooner after a respiratory infection? IgA nephropathy, it takes 1 to 5 days to occur. While if we speak about acute post-streptococcal glomerulonephritis, it takes 2 to 4 weeks. Okay? So it takes much more time. Okay, speaking about the rapidly progressive crycentric glomerulonephritis, how can you differentiate between various types? Which test are you going to do? The immunofluorescence testing. So if I have a linear immunofluorescence, what does it mean? Is it antibody mediated or immune complex or what? What about if it was a granular? Granular is immune complex. This is correct. Okay, so speaking about the crycentric, we have so many diseases. We have the Goodbaster syndrome. So Goodbaster, remember, it's an antibody attack against the glomerular basement membrane and also alveolar basement membrane. So they will be coughing blood and urinating blood. And the treatment is by getting the antibodies outside of their body. While if we speak about, for example, post-streptococcal glomerulonephritis or diffuse proliferative glomerulonephritis, both of these are considered a crycentric form of glomerulonephritis, but they will have a granular deposition. Okay? So one more thing I'm going to speak about is which eye pathology does people with Albert syndrome have? They have Lenticonos. Okay, Lenticonos. So what is this Lenticonos? Basically, their lens become like a cone. So if you take a look about the Lenticonos, you can see how the lens is becoming like a cone. Yeah, Lenticonos. Okay. By the way, let me, Albert, let me teach you how to read a slit lamp test. So what is a slit lamp test? It's basically this machine that an ophthalmologist has, and he basically flashes a light in your eye. After he does that, you can see this structure in the background, yeah? So this structure in the background is a little bit tilted. What is this structure? This is the lens, okay? So notice this guy. He can see it. This is the lens, yeah? This is a slit lamp test. So when you look at a slit lamp test, you can see the lens. See? This is the lens. and it's not straight. Basically, this is the pathology. Okay, so the next thing we are going to speak about is, can someone tell me please, in case of minimal change disease, which cancer is associated with it? Lymphomas. What are you going to see on normal histology? Lipids or sometimes minimal changes. Yeah, effacement of the podocytes. This is in electron microscopy, not in normal histology. Okay, speaking about electron microscopy, which other disease has the similar electron microscopy finding like minimal change disease? Like another disease that has the exact same finding of minimal change disease on electron microscopy. They ask it like this actually. It's focal segmental glomerulosclerosis. This is correct. So which type of which type they ask? So can you tell me please, which hematological disorder can lead to focal segmental glomerulosclerosis? Sickle cell. Okay, good. Good. So also one more question about membranous nephropathy. Membranous nephropathy. In case of membranous nephropathy, what are you going to see? And first of all, is it happening due to which infectious disease can it happen? Which infectious disease can lead to it? Membranous nephropathy. Hepatitis B, C, and syphilis. Yes. Can you tell me, please? This is nephrotic syndrome. What nephritic syndrome is associated with hepatitis B and hepatitis C? Yep, it's membranoproliferative glomerulonephritis. It's actually good that you said the last one. You know, stuff like this are really difficult to memorize because they are little point here, little point there. So you need to keep visual memory about these. So if we speak about amyloidosis secondary due to dialysis, let's say, which substance is accumulating? Which substance is accumulating during dialysis? Microglobulin. Microglobulin. Okay. So the next thing we have is in case of diabetic nephropathy, which portion of the kidney is affected first? The efferent arteriole. Okay, good. If it stays for a really long time, it can lead to this Camillostil Wilson lesion. Yes? Okay. So the next thing is kidney stones. Can someone tell me in which pathologies I can have a big stone? MAP and what else? Cystine. How can I differentiate that? Is it MAP or is it cystine? The pH will help, that's correct. But let's say that they were horrible and they did not give me the pH. They were even more horrible and they did not give me the shape. Exactly, the age. So the cystine will be in young, and the MAP will be in adult people. So the MAP happens because of recurrent biogenic infection, especially with a urease positive organism. Can you give me a urease positive organism? Yes, this is correct. Proteus mirabilis. Okay, good. Klebsiella as well. That's correct. Okay. So speaking about what are you going to see on basically urine, which crystal are you going to see in case of MAP? Coffin. Yep. In case of oxalate crystal, oxalate calcium stone, in which condition that is leading to malabsorption can you see it? Which malabsorption? Yeah, Crohn's disease, exactly. Okay, so in case of hydronephrosis, what will happen to your GFR? It will go down because the hydrostatic pressure inside of the Bowman's capsule will go up. Okay, in case of urinary incontinence, can you tell me please which one is related with UTI? Urgency incontinence. About multiple sclerosis, except of an overflow incontinence, which other type of incontinence does multiple sclerosis associate with? Urgency incontinence. I just want you to understand why. So this is a bladder, and it goes something like this. So it has an upper motor neuron here. This is the corticospinal tract. And it has a lower motor neuron here, which comes from the spinal cord. Okay? So remember, the upper motor neuron always inhibit. The lower motor neuron always activate. In case of MS, the upper motor neuron is shot. So when he's shot, what is going to happen to the lower motor neuron? He will become crazy, start firing at the detrusor muscle. When he start activating the detrusor muscle, what type of incontinence you will have? Urgency, exactly. Okay, let's speak about stress incontinence. So stress incontinence, these patients have a urination because of what is pathological? Is it the sphincter or the detrusor muscle in case of stress incontinence? It is the sphincter, correct. So how can you improve their situation? Training, casual exercise. Good. Well, can someone tell me what will happen to the post-void residual volume in case of overflow incontinence? It will be ridiculously increased, okay? Because he's not emptying, incomplete empty, he's not emptying. Okay, which receptors are located on the detrusor muscle? M3 and beta 3. This is correct. Okay, acute cystitis, which is also known as lower urinary tract infection, and pyelonephritis, known as upper urinary tract infection. Which one has systemic symptoms? Which one has urgency? Which one has chills? Which one is related to sexual activity? Okay, which one? How to reduce the risk of getting a UTI from an indwelling catheter? Yeah, remove it as soon as it's not needed. Yeah. Okay, so if we speak about what is this? thyroidization of the kidney because of chronic inflammation. Yep. What happens to the BUN to creatinine ratio in case of prerenal azotemia? Okay, exactly, normal to high. What about in case of intrinsic renal failure? Yep, low big time. Good. So what about the FENA, fractional excretion of sodium, in case of an intrinsic renal disease? Why low? In case of intrinsic renal disease, your tubules are not functioning. If your tubules are not functioning, can you reabsorb? You cannot. So the fractional excretion of sodium will go up. Exactly. Good. So in case of acute interstitial nephritis, which type of cast are you going to see in the urine? Not RBC. Eosinophils, exactly. Good. And can you tell me, please, in case of acute tubular necrosis, which type of cast are you going to see? Brown muddy cast. So, you know, in case of acute kidney injury, we know that normally the kidney filtrate, reabsorb, secrete, excrete. But which function of the kidney is the last to recover after acute kidney injury? Which function of the kidney is the last to recover after acute kidney injury? Is it the filtration? Is it the reabsorption? Is it the secretion? Or is it the excretion? Yes, it's the reabsorption. Well, due to this fact, what is going to happen to the urine volume during that period of recovery? Yes, polyuria. It will be up. Okay, can you tell me which portion of the kidney is the most susceptible to injury? BCT, can you tell me, is it the convoluted portion of the BCT or the straight medullary portion? The straight portion. Yep. In case of renal papillary necrosis, what are you going, renal papillary necrosis, you must know about, what are you going to see in the urine? Blood. Okay, you must know its association with the sickle cell disease or triad. Well, which one is better to have, disease or triad? Okay, and the next thing is consequences of diabetes mellitus. Which substance it gets accumulated inside of your body that can lead to pericarditis due to renal failure? Which substance will be accumulated in your body leading to pericarditis in case of renal failure? Urea, yes, it leads to pericarditis. How to treat this form of pericarditis? Dialysis, yes. Do not be fooled with choosing NSAIDs or colchicine. Well, by the way, speaking about this pericarditis, can you tell me, please, what are you going to see on the ECG? Actually, what you are going to see on an ECG, it's like any other pericarditis, diffuse ST segment elevation of all of the leads. Okay, so the next one is this one. Okay, let's speak about yeah, where is vitamin D made in the kidney? Is the distal convoluted tubule? Is it? It's actually vitamin D is made in the PCT. Okay, and I have one more question. Can you tell me, please, where is the reabsorption of phosphorus happening? Sorry, secretion of phosphorus happening. PCT. Okay, renal cyst disorder. What? So I will tell you a type of cyst, and you will tell me is it simple or complex. It has septation inside of it. It is well circumscribed. It can enhance and give color into it during CT with contrast. Okay, good. So if we speak about autosomal dominant versus autosomal recessive polycystic kidney disease, which one has the later presentation? Which one has association with perianeurysm and diverticulosis? Dominant, yeah. Which one, if someone has an perianeurysm, which form of a brain bleeding they will develop? Subarachnoid. This is correct. Okay, good. If we speak about the autosomal recessive polycystic kidney disease, except of the kidney, which other organ will be damaged? It will be the liver. Yeah, liver fibrosis. Remember about this. Okay, good. So speaking about, yep, let's jump to renal cell carcinoma. Actually, no, let's speak about this for a moment. So if someone has heart failure, what will happen to his RAS system? What is the most common cause of renal artery stenosis in a lady, young lady? Atherosclerosis will be an old man, but a young lady will be fibromuscular dysplasia. They love this question, be comfortable with it. You also can hear a bruit, which is a sound like present over the umbilicus, near the umbilicus, to the right and the left of the umbilicus. Guys, in renal cell carcinoma, we had the clear cells. What does the clear cells contain inside of them? Lipids and carbs. We know that some tumors have Berenioblastic syndromes, in which they start secreting some foreign substances that they normally do not make. Can you tell me what are the Berenioblastic syndromes of renal cell carcinoma? Okay, so yeah, the parathyroid hormone related peptide, the EPO, the renin, and the ACTH. Okay. Okay, so what color will renal cell carcinoma have grossly? It's yellow. exactly, because it contains a lot of cholesterol. Which, okay, so you know that renal oncocytoma looks like Harry Potter. Why? That's the scar in the middle. Is it benign or malignant? It's benign. Harry Potter is benign. Okay, so yeah, the next thing is nephroblastoma. You must know about this constellation of symptoms. So if the patient has enardia, what does enardia mean? Absence of the lens. Yeah, absence of the iris, sorry, not the lens. If they don't have an iris, will they become photosensitive or not? They will become sensitive. If the patient has hemihyperplasia, is it WT1 mutation or WT2 mutation? Yep, because it's the big with Weidman syndrome, the one with the hemihyperplasia. Okay, so I sent you actually a file today. I took like 20-30 minutes to write it in the morning. It has the ones with the most common type of epithelium that are asked on the exam. So yeah, it's this one. Take some time to read it. I mentioned different types of epithelium and some notes about each one. Okay, and in the end I provided a couple of pictures that can show it. So yeah, these are the main ones, the most commonly asked ones. Of course we have more, but I guess these are the most commonly asked. Okay, so let's go back. Yes. Okay, what is phenacetin? Phenacetin. Seriously? It's a drug for what? Yeah, it used to be an analgesic used back in the time, not used anymore because it causes cancer. So, squamous cell carcinoma of the bladder, is it the most common cancer of the bladder or there is something more common? No, it's not. The most common is the transitional cell carcinoma. Squamous cell carcinoma most commonly happens due to which protozoa? Schistosoma hematobium. Yes. Okay. So now let's speak a little bit about the drugs. So we have different sides of action of the drugs. If we speak about mannitol, it's an osmotic diuretic. So can you tell me please, it works mostly at which tubules? Yep. Okay, PCT. We can use it in a drug overdose because it can help excrete the substance into the urine. Okay. It's contraindicated in anuria because it will not be cleared. One more thing here, we have acetazolamide. Speaking about acetazolamide, it prevents the reabsorption of sodium bicarbonate, okay? Which lead to which form of acid-base disbalance? If you cannot reabsorb bicarbonate, what will happen to you? Metabolic acidosis, yep. So also, it can lead to one type of, oh, okay, first of all, where does it work? BCT. So now I can tell you it lead to one type of renal artery, it can lead for one type of tubular acidosis. Which type, since it works on the BCT? Since the acetazolamide can function at the BCT, which type of tubular acidosis, renal tubular acidosis, can occur in it? It's basically type 2, guys. Remember, in type 2, it's proximal renal tubular acidosis occurs at type 2, okay? Type 2, not type 1. Okay, so let's take a look. Speaking about the loop diuretics, can you tell me please, what is the function of the loop diuretic on calcium? Do they reabsorb it or excrete it? They excrete it. Okay. Is loop a sulfa drug? Okay. What about ethicrinic acid? Is this ethicrinic acid, do we consider it to, what side effect it has? Really serious one. Yes, it's highly ototoxic. Speaking about thiazide, can you tell me please regarding thiazide, what will happen to the calcium level in the body? Taking thiazide for a long time remind us of one type of congenital renal tubular defect. Which one was it? Gittelman, correct. So if we speak about osteoporosis, which diuretic would you like to use on the patient? Okay, if we speak about, yep, we have Liddle syndrome and we have the same syndrome. Liddle syndrome was due to overactivation of the ENaC channel. So which potassium sparing diuretic we will use on in this syndrome? Amiloride and the triamterone. Okay? Because they work directly at the ENaC channel. But if we speak about same syndrome, system of aberrant mineralocorticosteroid axis, it works by activation of the aldosterone receptor. So which drug can we use to stop it? Spironolactone and eplerenone. Yep. Which one between eplerenone and spironolactone have highest risk of gynecomastia? Correct. Okay, so if we speak about the ACE and the ARBs inhibitor, what leads to the cough? Okay, and which substance lead to the cough? Is it low bradykinin or high bradykinin leading to the cough? High bradykinin. Okay, if we speak about the diuretics, which one of the diuretics lead to high amount of potassium? Potassium sparing, exactly. Okay, I want you to be careful about one thing. It's between the lines, so it's important. If someone using ACE inhibitor, he will have high risk to have hyperkalemia. If he concurrently is using potassium sparing diuretic, this also can lead to hyperkalemia. If he's using also a beta blocker, that can lead to hyperkalemia. So be careful about patient using so many drugs that lead to hyperkalemia. Okay? Okay. Really high hyperkalemia can lead to problems in which organ? The heart. What it will lead to the T wave? Yep, tall and lengthy. Exactly. Good. What about hypokalemia? What it will lead to the T wave? Okay, good. So one more thing, this is important. If we speak about the acetylsalicylic acid, also known as aspirin toxicity, initially which form of pH disbalance you will have. No, metabolic acidosis is actually late. Initially, you will have activation of the respiratory center, which will make you hyperventilate, which will give you early respiratory alkalosis. Then your kidney will start, then the acetylsalicylic acid will start to accumulate so much in your body, which give you the late effect of aspirin, which is increased ion-ion gap metabolic acidosis. Okay, good. So yeah, that's pretty much it for renal. I saw a few questions. Please forward them, all of them, and I will be answering them. Like I will write complete answer on each one after the class, since I have one more thing to do at 9 o'clock and I have to prepare myself for that. Well, thank you so much. That's it for today's session, and I will see you guys tomorrow.